This is a common misunderstanding that is out there. No, you do not get diabetes from eating too much sugar. The development of diabetes is a complex situation that results from genetics, which is by far the biggest predictor, as well as the environment. And in the case of the environment, it is things like increased weight that may contribute, and food and physical activity may play a part, but ultimately you need the genetics to be in place in order for diabetes to develop. So therefore, no, eating too much sugar is not the cause of someone's diabetes, but it is in fact a chronic disease that they developed due to genetic factors.
Special occasions and holidays can sometimes make it challenging to stick to your dietary goals because overeating can unfortunately be one of the things that can result, when we're out and we're celebrating any kind of festivities. And so I do have some tips to help you make wise choices if you happen to be celebrating, no matter what the event or the occasion. So one thing I recommend for most people, if the event or the environment is appropriate for it, is that you put your food on a plate. So eat from a plate. This allows you to see what and how much you're actually eating. If you tend to nibble or graze, then you're eating mindlessly and you're not really aware at all times of how much or what it is that you're consuming. Now, leading from that, I would say to also use the plate method. So putting your food on your plate and then combining that with the plate method now will help you with the appropriate portion control. So on one half of your plate, you would fill those with vegetable options. Depending on what's available, you might go for some raw veggies. So for example, veggies and dip or a green salad, or you might choose from some cooked options such as stir-fried vegetables or steamed veggies. On the other half of your plate, you would then divide that between your starch and your protein. Try to go for protein foods that have been cooked in a lower fat way. So for example, baked chicken or grilled fish or anything that has been like stewed or broiled would tend to involve some lower fat food prep methods. The other quarter of the plate, then you would put a grain or a starch. Now, this doesn't mean that you need to stay away completely from foods that you love, especially if those foods tend to be the higher fat, higher sugar, high salt choices. But using the plate method allows you to take just a little bit of those foods and then to fill that half with the vegetables that you would use to help to give you some satiety and to give you some feelings of fullness. Another tip that I have for most people is that you try to avoid showing up really hungry. So some people will try to save their calories or, save themselves because they know they're going out. And that's one thing that can sometimes lead to overeating if you show up somewhere and you're extremely hungry and then you're surrounded by a lot of options. Another tip, create that environment. So if you are the host, it is easier because then you have some control over the foods that are being served. You can prepare an assortment of meals and dishes that include all the food groups for sure, but then you would also want to try to provide at least 2 vegetable-based dishes just to give people some options. Another tip is to limit your alcohol intake. So if you tend to drink, limit your alcohol intake when you're out because not only will alcohol have an effect on blood sugar levels, but alcohol can also lead to overeating just because some people can use food to counter the effects of alcohol, or because of the social atmosphere, then inhibitions are lowered and then you're not as thoughtful about the food choices. And those are some of my top tips that I have for planning when you're eating out or if you're at any kind of festive event or special occasion.
There's some new terminology floating around in the diabetes world called looping, and not many people know exactly what that means. So looping is a way of connecting an insulin pump and a continuous glucose monitoring system in such a way that there's a loop that's created. So the feedback of your glucose levels is given to the insulin pump, and then the insulin pump can take those glucose levels and so-called close the loop, which means that glucose monitoring is no longer required, that the pump is programmed to sense the glucose levels and then continuously deliver insulin to manage them. So it's important to know that there's sort of 2 types of looping that are available. So there's the closed loop pump that's been manufactured. So it means that the continuous glucose monitoring is built right into the pump. There's algorithms inside the pump. After a couple days of continuous wear, the pump senses what the insulin levels are required to keep the glucoses in the target range. And that basal dose is being delivered. So far, we don't have any to deliver bolus doses, but it closes the loop. So it uses your own glucose data from your CGM, and you deliver insulin accordingly from the pump. So that is a manufactured type. And then there's a group of people called DIYs or do-it-yourselfers that are also looping, and they're using their own devices, and they're using other insulin pumps that they have been able to crack into and be able to get them to talk to each other. And those are not regulated. Doesn't mean that people aren't using them successfully. It's just that we as healthcare professionals can't tell you that it's necessarily okay. But looping in the end is using continuous glucose monitoring data that's fed directly into the pump, closes the loop, requires less work on the part of the individual because the glucose patterns and trends are recognized and insulin dosages are delivered automatically to achieve the best glycemic control possible and reduce the amount of hypoglycemia and hyperglycemia that a person has.
This year, it's particularly important that everyone who can get a flu shot please go and get a flu shot. We really are trying to make sure that we are minimizing any burden to the healthcare system due to the possible syndemic or twindemic, if you want to think about it that way, wherein you're having the uptick of COVID cases as well as it is influenza season. So we're hoping to make sure that prevention is the best medicine, and we're trying to prevent hospitalizations and prevent death with the influenza vaccine, which has been proven to do those things: prevent hospitalization and prevent death. So where can you get a flu shot? Well, generally the same places that have always been available, which would be your primary care provider's office. So that would be either your family doctor or your nurse practitioner. Community pharmacies offer flu shots, and then you can often get them also at the health unit. And sometimes you get pop-up clinics around places, so you can just watch out for various advertisements that way. I think that one of the important things to think about is how to prepare yourself for getting a flu shot. You want to make sure you're wearing a mask. That's very important when you go to get your flu shot. And then you also want to wear short sleeve shirts. Just make it easy for them. You know, you want to minimize your time in, minimize the huffle and the fuss, and just have your arm up and ready to go. And then the other thing that we're just asking is just to double check if there's any restrictions where you're going to go. So for example, in Ontario, flu shots can only be given in a community pharmacy to people 5 years of age and older at this time. Things might change in future, but right now in a community pharmacy, for example, in Ontario, you have to be a minimum of 5 years. But for that reason, I do know health units are very much aware of this, and family health teams are also very much aware of this, and they will target their flu clinics to people from 6 months to 4 years and 464 days old, and they'll make sure that that they're making sure that that population has easy access to flu shots. You'd also want to double check when you're going about to get your flu shot. Double check the whether you need to do it by appointment or whether a walk-in is possible. And of course, if you have an appointment, you just don't want to show up extremely early for your appointment. Show up kind of just right at that time, because we're really trying to minimize the number of people that are present in the facility. And then if it is a walk-in, please just be patient. Recognize that social distancing, stay apart, carry your hand sanitizer, wear a mask, stay safe. All right, good luck, get that shot.
Prediabetes refers to blood glucose levels that are elevated, but not high enough for you to be diagnosed with diabetes. If your doctor has diagnosed you with prediabetes, it's really important for you to have a conversation about the next steps to help you prevent diabetes or delay the onset of diabetes. These next steps can include consuming a healthy diet, increasing your physical activity levels, and losing weight if weight is a concern. Your doctor may also start you on medication in addition to healthy eating and increasing your physical activity levels.